ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, welcome, and thanks for tuning in to ECDC On Air, the podcast of the European Centre for Disease Prevention and Control. I'm your host Lee, recording from our headquarters in Stockholm, Sweden. Today we are again joined by Agoritsa Baka to discuss the ongoing monkeypox outbreak in Europe. Agoritsa explains what monkeypox is and where it came from, but more importantly, she explains how you can recognize symptoms and what you can do to keep yourself safe. Agoritsa, welcome. Before we begin, I know we've spoken before, but could you briefly explain your primary role here at ECDC?
Yes, thank you. It's nice to see you again. I've been working at the ECDC since 2018 as a principal expert for preparedness and response in the EPRS section. And in the last few years, I've been heavily involved in the public health emergency for COVID and currently for monkeypox.
Okay, so we are talking today about the current monkeypox outbreak. Can you give us a bit of background on monkeypox? So like, what is it and where did it originate?
Yes, so monkeypox is a tropical disease, and in the tropics, it infects people through contact with animals, mainly. And this could be either bites or preparing what we call bushmeat in Africa, like little animals that are caught and hunted and caught for food. Preparing bushmeat for eating. And then what we used to see is small chains of transmission, usually in the household. Of course, we definitely believe that monkeypox is underreported in Africa. And for Europe, it was just an imported rare disease. A few cases, maybe one or two per year, from travelers who were infected in Africa and came back to Europe.
Okay, so before it spread to Europe, what was the primary route of transmission? I mean, you mentioned eating bushmeat and things like that. Was there anything else?
Monkeypox, we know it's transmitted from human to human also. And it's transmitted through contact with mainly with the rash, with what we call the lesions. The lesions have fluid in them, and in that fluid there is a lot of virus. So anyone coming in contact with that fluid, and we know with prolonged physical contact, like sleeping in the same room or something like that, sharing also utensils, and finally what is called fomites, meaning contaminated objects. Which could be anything in the environment or even linens, clothes, and this type of thing.
Okay, before this current outbreak, have there been outbreaks of any size previously?
Well, the way it has evolved right now, we are facing the largest documented outbreak of monkeypox in humans. There have been, of course, outbreaks in sub-Saharan Africa. They have been documented mostly in West Africa. One of the largest ones was in 2017 in Nigeria, from which we have a lot of data. However, in the United States in 2003, there was another rather large outbreak again, which was related to infected pets. Animals, a certain type of pet rat, which was imported from Ghana.
Okay, when did the alarm first get raised on this current outbreak?
So for this current outbreak, it was early in spring, rather early May, when we realized that we had the cases in men who have sex with men. They were first diagnosed in the UK, the United Kingdom. However, there were suspicions already in Portugal that something was going on, and it was later confirmed also monkeypox there.
What is unusual about the current outbreak?
So the most unusual thing is that the virus has found its way into sexual networks, which are very interconnected and international. And it looks like it's continuously circulating in the population of people who have several sexual partners, including some MSM. And the vast majority of the cases that we have diagnosed until now is in males between 18 and 50 years old.
How worried should people be? I mean, how severe can it get for an individual?
So that's a very good question, and we should say something about that. What we know from the classic description is that definitely there are severe cases, usually connected to very young children, pregnant women, and we also know in immunocompromised persons. The only group that we have seen until now is HIV, people living with HIV. Particularly children in Africa suffer from secondary pneumonia, secondary bacterial infections, dehydration. It's rare, but they may exhibit also encephalitis and this type of complications, which are really fatal, especially in the setting of Africa. In the particular outbreak that we are seeing now, multi-country, but not in endemic countries, the symptoms are mild to moderate. Most of the people have very localized rash. Some do have lesions in other parts of the body, but mostly in the genital area. They do have, though, some severe complications that we have heard of, which is pain, proctitis, which is an inflammation of the area of the rectum and the anus, and that makes it really hard for them. And also, again, secondary bacterial infections.
So up until now, there's been a lot of targeted communication towards the gay, bisexual, and men who have sex with men community. Is there a danger that monkeypox could be seen primarily as a disease that only affects this community?
We are very concerned about what we call stigma or stigmatization, either of the disease or of the community or the sexual practices even. And this needs to be seriously tackled by the public health authorities. We have produced a lot of material, both by the ECDC, but in collaboration also with WHO Europe and civil society organizations. And we're trying to give them a lot of examples of approaches that other countries are using, also material which is not connecting the disease with sexual identity. And this is actually a big challenge which will impact also the diagnosis, so it doesn't help anyone.
What sort of tests can confirm whether someone has monkeypox?
Yes, that's also a very good question. So monkeypox has a very particular clinical presentation. However, the rash in particular is very characteristic, and it has a certain clinical progression. However, in this particular outbreak, we've seen many differences. So I would say the only way that you would be sure that you have monkeypox is only through a laboratory test, which is finding the DNA of the virus.
You mentioned that for human-to-human contact is really the primary route of transmission. Should people avoid others, or should they avoid events? With the summer coming up, we're obviously seeing a lot of mass gathering events. Should people be avoiding these, or what is ECDC's recommendation?
So we have produced guidance for this event also for the public health authorities in the countries which are hosting big events this summer, which are not necessarily targeting MSM audience, but big music festivals, for example, or something like that. This is extremely important in the sense that we do not advise people to avoid these big events unless they have symptoms. If they have symptoms, we do advise them to take a break from these big events and get tested or get examined at least by a physician, and if advised, to get tested. Going to those events is not necessarily putting you in high risk. It's the activities around those festivals or events that sometimes lead to having multiple sexual contacts and this type of thing, which is high risk.
What should people consider when engaging in close contact with others, particularly in sexual activities?
Well, they should be aware of their own health status, that meaning if they have symptoms, they should avoid having sex because they might transmit the disease, and they should get examined and tested if needed. This is the most important thing, and particularly if they notice any type of rash, which is not unexpected, they should try to avoid having contact with very young children, pregnant women, immunocompromised persons until they get tested.
Okay, there has been some messaging to avoid contact with pets if you do test positive. Why is that?
Yes, this is also extremely interesting because for Europe, monkeypox is an imported disease. And we know that in Africa, it is maintained in nature by circulating in certain animals, mostly small mammals and rodents. So there is this low risk in Europe that it could become an animal disease also. We do not have data about the animals in Europe and how much they might be vulnerable to monkeypox, but it's assumed that they are. So we need to keep it in the back of our heads. And so our recommendation is particularly for somebody who has been diagnosed as having monkeypox to avoid coming in contact with their pets. The same is also advised for people who are close contacts of a monkeypox case until 21 days have passed.
Where can people find more information?
So at the ECDC, we have a dedicated monkeypox page, ecdc.europa.eu/monkeypox, where we have a lot of information for public health authorities, but also for the public. And of course, WHO Europe has also relevant information, and we are still developing more documents for everyone.
Okay, great. We'll put links to those in the notes of this episode. But thank you very much for your time today, Agoritsa. We really appreciate it.
Thank you so much for having me.
We hope you found this episode informative. You can find more information about monkeypox on the ECDC website in the dedicated section on the outbreak. Links to this are available in the notes of this episode. For more information in general, please visit ecdc.europa.eu or follow us on social media for the latest news.